And many are now saying that the crisis at the border is not only a humanitarian issue, but also a medical issue.
Yeah, many of these children crossing the border are not getting adequate medical screening. And ABC 15's Navita Fergani is joining us live.
And Navita, this is raising some pretty serious health concerns.
Yeah, these health concerns, Stephanie and Steve, are something that I broke back in June when we took our cameras down to Texas to look at the problem firsthand. Border agents in southern Texas sharing their concerns, and the problems have only gotten worse.
It's a concern we first exposed last month.
We're having an outbreak of scabies. We're starting to see chickenpox. We're starting to see staph infections. We're starting to see different viruses.
Rio Grande Border Patrol Union VP Chris Cabrera told me during that exclusive interview that his biggest worry was the spread of infectious diseases.
Some of these viruses are asymptomatic at this point. They're not showing the symptoms. But once we start sending them around the country, they start popping up with symptoms.
In a Department of Defense memo reviewed by ABC, the director of Refugee Health has identified a breakdown of the medical screening process at the facility in Nogales, Arizona. ABC reporting numerous viruses from chickenpox to influenza. Border Patrol Union representatives in Arizona tell me they've also seen some positive cases of TB.
Obviously, the skin test shows that you've been exposed, but no active cases have been found from those positive skin tests. My main concern was that if they do have a positive skin test, they should be isolated. The child needs to be isolated until all the proper medical screening is done.
Some of those viruses now spreading to California. HHS confirmed to ABC News an outbreak of pneumonia and influenza at the Ventura Naval Base, housing many undocumented minors. And according to that memo reviewed by ABC, 2 children from the Nogales facility were flown to the base with a fever and flu-like symptoms, exposing a breakdown in the medical screening process.
And while the infectious diseases haven't spread into the communities that these undocumented children are staying in, Border Patrol agents tell me there is still a risk, because if agents get infected, they can take those viruses home to their families.
All right, Navita, thank you.